Once your cervix is fully dilated, baby's head will move down towards the vagina, making a passage to come out. You may or may not get an urge to push even if you are fully dilated. If you don't get the urge to push with your contractions, that means you are in passive stage of labor. Active second stage is when you have an urge to push with your contractions. You will give birth within 3 hours of active pushing if it is your first baby and 2 hours if you have delivered before. Pushing and position can make a crucial difference in labor outcomes. Research says upright position can make your second stage shorter and more comfortable, as with the gravity baby comes out easily. Upright positions can be kneeling, squatting, standing, leaning on a birth ball. But some women don't feel very comfortable in upright position because of the intense pain. Try a position in which you feel more comfortable. It could be lying on your back on the bed. You can help yourself in pushing by not holding your breath while pushing. Focus on pushing and concentrate on bearing down when the contraction comes. Push as if you want to open your bowels in the toilet. Push with the contractions and relax in between the contractions. Always stay focused and positive. Try the position you are comfortable with. You can tuck your chin to your chest while pushing. With subsequent pushes, a stage will come when you need to push one more time for the baby to come out, and that will be your last push. When the baby's head comes down to your perineum and is ready to be born, you will get a stinging or a burning sensation down below. This is when the crowning happens. That is, your baby's head is all set to come out. Slow down your pushing efforts at this point. At this point, when the head delivers, the midwife or the doctor will also protect the perineum so that there are no tears. And after the head is born, there will be a pause in between the contractions before the shoulders and the rest of the body is born. Once the baby delivers, you can have skin-to-skin contact with the baby. After the birth of the baby, umbilical cord has to be cut, which will separate the baby from the placenta. Evidence and research says babies benefit from delayed cord clamping as it allows extra blood to be transferred to the baby. This will increase the amount of iron transferred to baby, which is essential for the brain development. Immediate clamping of the cord after the birth can result in dropping of blood pressure of the baby, which is unlikely to happen if the delayed cord clamping is done. All international organizations recommend cord clamping should be delayed and cord should be cut between 1 to 5 minutes after the birth of baby. Baby's first hour of life is very crucial, and you can make it best by having skin to skin with your baby. Skin to skin is placing baby on mom's bare chest, and baby will start crawling on towards one of the breasts. This is known as breast crawl. Skin to skin contact in first hour of life has enormous benefits. It regulates the baby's temperature and builds a strong immunity. It also increases emotional bonding between you and your baby. It also serves an excellent opportunity to breastfeed your baby in the first hour of life. If you get to deliver vaginally, do give benefit of skin to skin to your baby. You can always discuss about this with your attending doctor during pregnancy. Third stage involves placental separation. Placenta occupies a lot of surface area of the womb in pregnancy. After the delivery of baby, uterine cavity suddenly diminishes in size, and this reduces the effective surface area of the placenta. Shearing forces between placenta and the placental site cause separation of the placenta from the uterine cavity. After complete separation, placenta comes in lower part of the womb and then is subsequently expelled out. Usually, two types of strategies are used to manage third stage of labor: physiological and the active management. In all the hospitals, doctors prefer to have active management. In active management, a drug called syntopmerine or syntocinon is given to help the uterus contract. These contractions will help in separating the placenta from the wall of the uterus easily. Major benefit and why everyone prefers to have an active management is that it prevents you from having excessive bleeding after the birth. Placenta should deliver within 30 minutes of the active third stage of labor. Physiological third stage is when the placenta separates itself naturally by uterine contractions. It might take 1 hour to separate, and sometimes if it doesn't separate at all, then it is called a retained placenta. This retained placenta has to be removed manually. The major disadvantage with this technique is that you have high chances of having heavy bleeding. After the delivery of placenta, whole placenta along with the membranes will be examined to ensure that everything is complete and nothing is left inside the womb. Some tips for quick delivery of the placenta are: have skin-to-skin contact immediately after birth. Hold your baby, as this will cause more oxytocin to release and this will increase your contractions. Start breastfeeding immediately after birth. Sit upright, as the gravity can help to deliver the placenta out easily.